Good afternoon, everyone. Thank you for joining us this afternoon. I'd like to first start by acknowledging and paying respect to the Wurundjeri people as the traditional owners and custodians of the lands that I'm meeting on today. And I also would like to pay respects to elders past, present and emerging, and any other First Nations people joining us today. I also acknowledge that we are all on Aboriginal land across Australia and sovereignty was never ceded. It always was and always will be Aboriginal land. Before we kick off today, I just want to also give a content warning before we start. We will be discussing issues that will include references to Aboriginal and Torres Strait Islander persons who are deceased and discussions of self-harm, trauma, violence and abuse and racism. If any part of our conversation or discussions raises issues or concerns for you, we really encourage First Nations people joining us today to call Yarning Safe and Strong, helpline run by the Victorian Aboriginal Health Service, and Lifeline for anyone else that's present today that would like to contact them. The numbers will be available in our chat function. So I'd like to welcome everyone to the webinar today, which is Healthcare Not Handcuffs, an Aboriginal-led health response to public intoxication. And it's great to see so many of you already joining us here and continuing to trickle in. My name's Emily Yates. I'm a proud Bundjalung woman and I am the managing lawyer in the VALS criminal practice, and I'll be moderating today's session today. For decades, the offence of public intoxication has been applied in discriminatory ways, and it's disproportionately affected and targeted Aboriginal people, which has led to further criminalisation. If you were drunk in public, police could arrest you, detain and charge you, or issue you with a fine. Removing the offence of public drunkenness was a recommendation of the Royal Commission into Aboriginal deaths in custody more than 30 years ago, and the Royal Commission looked at the deaths of people who had been arrested just for being intoxicated in public. However, what followed was years of inaction, and Aboriginal lives continued to be placed at risk by being in custody for intoxication. Throughout all of this period of inaction, community continued to fight for this reform. In December 2017, proud Yorta Yorta woman, Auntie Tanya Day, who was much loved mother, grandmother and sister, passed away after she was arrested for public intoxication. Despite causing no disturbance, Ms. Day was arrested after she fell asleep on a V-Line train on her way back to Melbourne. While in a concrete cell at the Castlemaine police station, Auntie Tanya fell and hit her head, later passing away in hospital. Due to the staunch and tireless advocacy of the Day family, in 2019, the government committed to decriminalising public intoxication and replacing it with a public health response. 5 years later, the law has changed. As of 7th of November last year, it is no longer a criminal offence in Victoria to be intoxicated or affected by alcohol in public. This means police can no longer arrest, detain or fine anyone for the offence of public intoxication. Instead, if someone is affected by alcohol in public, they can access support through their local Aboriginal community-controlled health organisations. We all know that being affected by alcohol in public should be seen as a health issue that requires a holistic health response. Treating public intoxication as a criminal issue meant that people were not getting the support they needed and instead being unnecessarily drawn into the criminal legal system. Because of the Day family, their tireless advocacy, our ACCOs are now funded to provide and support for people who are intoxicated in public. That can involve outreach workers assisting people to get home safely, people having a safe place to stay the night at a culturally appropriate sobering centre and places of safety, and people getting linked into more holistic health services if that's what they want and need. Over the next hour and a half, we're going to be delving into more detail about what these health services look like and how they can support our community. As we begin this conversation, it's also important to keep in mind that these services and supports are relatively new and in the early stages, and there's a lot more to unfold as the reforms continue to unfold. I'll now like to introduce our amazing speakers that are joining us today. We're lucky enough to hear from a panel of experts who have dedicated years of their lives to advocating for the importance of public health responses and who will share insights from their experiences and learnings on what the public health response should look like. First up, I'll welcome Al Triant-Afalu, Managing Lawyer from the Wirraway team at VALS. Al, would you like to introduce yourself?
Thanks, Emily, and thank you for having me. So, as you said, my name's Elle. I'm currently acting as the managing lawyer in the Wirraway team. Our team looks at police and prison accountability issues and also represents family members who have loved ones who have tragically passed away in custody. And I'll be explaining the role of police in the new reforms and the health response.
Great, thanks, Elle. We also have Melissa Donovan, Manager of the Public Intoxication Response Centralised Service at the Victorian Aboriginal Health Service. Melissa, could you please introduce yourself for everyone?
Thanks, Emily. Hi, everyone. My name is Melissa Donovan. I'm the manager of the Public Intoxication Response Centralised Service for VAHS. I've been working in Aboriginal community control for around 15 years, and I have a strong background in AOD and justice. I'm also extremely passionate and dedicated about making change, advocating and supporting the wellbeing of the community.
Thanks, Melissa. Also on the panel today, two representatives from Ngwala. We have BJ Ribbons, Program Manager at the Metro Public Intoxication Response, and Motu Esse, a statewide Executive Manager for Public Intoxication Response. Motu and BJ Ribbons, could you please introduce yourselves?
Hello, everyone. Thanks so much for having me here. Yes, my name is Motu Esse and I am the Executive Manager for the Public Intoxication Response statewide for Ngwala. My function is to look after public intoxication response, not just in Metro Melbourne, but all over the other regions. Look forward for a yarn. You, BJ.
Thank you, Marks. Hi, everyone. Thanks for having us. My name's BJ. I'm the Programs Manager, PIR Metro. I'm a proud Goongarri Kamilaroi woman. I'm very passionate about what's happening. So, yeah, I'm looking forward to having a yarn with you all as well.
Great. Thanks, BJ and Motu. We're also going to hear a pre-recorded message from April Day, the daughter of Arnie Tanya Day, as well as a discussion between Nina Kirby, our Community Legal Education Officer at VALS, and Grace Bushkins, who is one of our principal managing lawyers from VALS, about the reforms. Audience members can add questions, as it's mentioned, to the Q&A chat, and panellists will answer that towards the end if time allows.
February 19th is a really significant date for my family and the Aboriginal community. It's the date that public drunkenness was finally passed to be decriminalised in Victoria. Public drunkenness is and always has been a racially discriminatory law against Aboriginal and Torres Strait Islander people, and it was first recommended to be decriminalised back in the Royal Commission into Aboriginal deaths in custody. And one of our uncles, Uncle Harrison Day, his death was actually examined in the Royal Commission, who was also arrested for public drunkenness. It was actually a $10 unpaid fine for public drunkenness, and when they had arrested him, he was sober, and then he suffered an epileptic fit in the Echuca police station where he later died. So there's definitely layers when we think about our family and how significant it is to finally get that decriminalisation, and that come of years of campaigning for that to finally be decriminalised from my family, community, our allies and supporters, but as well as community members for generations before us. Police have always used that law to racially target our community members. Our community members are the highest rate of people to be arrested for public drunkenness and highest rate of the risk of dying in custody. There was 339 recommendations that all speak to our family members' deaths and what led to them. And if the Victorian government actually took it seriously about how our people are dying in custody at alarming rates, they would look back at that Royal Commission and those recommendations and start to meaningfully implement those to be able to keep our community safe. And when I say meaningfully implement, I don't mean that they implement something and they tick a box. I mean that they actually have community infrastructure, they have Aboriginal voices that are leading that there is enough funding, so our community is adequately funded, and that we're actually established and set up in a way that is going to be meaningful and succeed. Not simply saying that you're going to tick a box and not fund our community, and then when it fails, sit there and say we tried our best but it didn't work. At the end of the day, Aboriginal deaths in custody is a government issue. Our community members are dying at the hands of the state, and it should be their responsibility to ensure that our community are not being racially profiled and arrested, they're not being upcharged, and that when we actually do have coronial recommendations and that these coroners are handing them down, that these individual institutes implement those recommendations to be able to keep our community safe, because if they do not start to take Aboriginal deaths in custody seriously as an issue for everybody, our people will continue to die in custody. If the public drunkenness had been decriminalised back when Mum was arrested, she'd actually still be here today, because they wouldn't have been able to racially profile her and use that to be able to place her in custody where she then later died. So when I think about this law and that it is no longer being able to be utilised by police, I see that as a life-saving measure that we've been able to campaign and put in place.
I'm Nina Kirby. I'm a Gunditjmara Wemba woman, and I am the Community Legal Educator at the Victorian Aboriginal Legal Service.
I'm Grace Bushkins. I'm the Principal Managing Lawyer of the Criminal Team here at the Victorian Aboriginal Legal Service.
Grace, can you run us through the changes to the public intoxication legislations and explain how these changes will affect our Aboriginal community?
Under the previous public intoxication laws, police could arrest, detain, fine or charge people for a criminal offence while they were intoxicated in public. So the change is that police can no longer do that. They can't arrest you, detain you or charge you for a criminal offence simply for being intoxicated. So the new legislation aims to redefine public intoxication as a criminal issue that requires a punitive response, and instead it's something that requires a public health response. The key thing I want to say about that, though, is that a person can still be charged with a criminal offence committed whilst they're intoxicated. So, for example, say somebody's intoxicated and they damage the property of somebody else, you can still be charged with criminal damage in that circumstance.
Based on cases you have observed in VALS criminal practice, what are the key takeaways for community members regarding the updated legislation?
First of all, that there is a real level of support available, and we're going to hear a bit later from the local ACOs about the services that they're going to provide. But from a criminal perspective, historically, police have used public intoxication laws to target Aboriginal people. So it's really important that you know your rights under new laws and what the new police powers look like now. And I might use this opportunity just to tell you a brief story about one of our clients who we recently assisted. So this person was arrested for public intoxication shortly before the changes came into effect. That person had experienced a level of trauma in the days previously that provided a lot of context as to why they were intoxicated at the time, and I'm not going to go into that right now. But initially, the public recognised that this person needed some help. They called an ambulance. The ambulance came, the person didn't require medical attention and didn't want any assistance. The ambulance then called the police, and the police spent quite 20 minutes trying to assist this person. This person said, look, just leave me alone. I want to be left alone. The police then decided to arrest that person, and the person resisted, and there were criminal charges that followed on from that. Now, under the new legislation, that will not happen. That person would have been left alone and their choice would have been respected. That person wasn't doing anything wrong prior to the fact that police decided that it was in their interest to criminally charge them for being publicly intoxicated. Now, VALS was able to assist that person. We had all of those charges completely withdrawn. So I want to encourage anybody who knows people who might have these charges coming up in court to speak to us first, and we can look at assisting you in having those withdrawn.
What role do you see community legal education playing at empowering community to access support services rather than facing punitive measures for public intoxication?
So CLE, community legal education, can help people understand their legal rights, which is the fundamental point of CLE. It can promote understanding and trust in the community, run support services that are available that we're going to hear about shortly. It can reduce the stigma around public intoxication and alcohol and other drug issues more broadly. All these things collectively really empower the community to actually reach out and access the support services that are available.
It's very important for our Aboriginal community to, access our community legal engagement and education so that we can understand what our rights are when it comes to public intoxication. Where can we go, what services we can access, and not just for ourselves, but for our families and community. What are some key challenges or misconceptions that remain regarding the legal rights and responsibilities of individuals who are intoxicated in public?
Yeah, so just because public intoxication is no longer a criminal offence doesn't mean that there's no support available for individuals who are intoxicated in public. And yeah, we're going to hear a little bit more about that coming up very shortly. There might be still some misunderstandings about what police can and can't do. For example, they still can come and talk to you. And really importantly, they can still charge you for other offences. So a little bit like I said earlier, anything that happens whilst you're intoxicated that's a criminal offence, for example, a criminal damage, the police can still charge you with that offence.
I'd like to say, if police are trying to move you on, please don't be cheeky and argue back with them, and don't give them a reason to arrest you.
Very insightful views there from April, Nina and Grace, and I'd just like to thank them for their contribution with that pre-recording. But we'll now move on to the panellists that are here today. So Elle, we'll get kick-started with you. Under the new legislation, what is the main role of police in the health response to the public intoxication?
Thanks, Emily. I'd also just like to start by acknowledging the tireless advocacy of the Day family and the advocacy of everyone in the Aboriginal community, which has led to these public intoxication reforms in the health response. And I just wanted to emphasise that this is a really long overdue reform. So my fellow panellists are going to go into the health response in a little bit more detail, including the role of their services, but I'm just going to outline what role the police specifically are meant to have under the new laws. So, as Grace said, the offence of public drunkenness has been abolished. Police can't charge somebody or arrest somebody just because they're intoxicated. Police can still respond to people who are intoxicated in public, and police can become involved in a few different ways. So they might become involved if somebody calls 000, or if police are on patrol and they see someone who's affected by alcohol in public, they can approach them. Or as Grace said before, and I'll go into this in a little bit more detail, if somebody is intoxicated and they've also committed an offence, police can be involved in those circumstances. So something that's really crucial and important to remember about the reforms is that in most situations, if police come up to somebody who's intoxicated in public and offer support or involvement, that person has to give informed consent. So they don't have to accept police help, except in some limited circumstances, and they can change their mind at any time. The circumstances in which police can be involved without the person's consent is when someone needs emergency medical care. So police play a role there, and their role is to call an ambulance and to call health services, not to, transport them themselves. And police can do that in those, exceptional circumstances, even if somebody doesn't agree to that. If someone doesn't need emergency medical care but would like some help from police, there are a number of options available to police they can consider. So they can place that person in the care of a family member or a friend or a carer. This could also include getting a friend or family to come and pick the person up. They can also get in touch with a family member or a friend to organise a taxi or a ride share or something like that. They can call an outreach worker or a sobering centre. And as I said, my fellow panellists will go into that in a little bit more detail. And they can also transport someone in a police vehicle in very limited circumstances as well. Importantly to note, police can also simply leave somebody alone if they don't want help. They don't have to get involved unless, as I said before, emergency medical care is required.
Thanks, Ellen. I think that's a really important note, that it is informed consent and you can change your mind at any time about that. Leading on from that, and you've sort of touched on it already, but what powers do police have to arrest, detain or fine people who are intoxicated in public?
Yeah, so the offence of public drunkenness or public intoxication has been abolished. It's no longer an offence. So police can't fine, arrest or detain someone just because they're affected by alcohol in public. Police still have all their other powers to fine, arrest or issue move-on orders if somebody has committed a separate offence. For example, if police think that somebody is behaving in a manner that's likely to cause injury or a risk to public safety, they might issue a move-on order. As Grace mentioned before, if police suspect somebody's done something like criminal damage or is behaving in a disorderly manner in a public place, something like that, those kind of minor summary offences, police can still do things like issue a fine, and in some cases they might even use that as an excuse to arrest somebody. And we know that First Nations people are targeted and racially profiled by police, and that sometimes these minor summary offences are used as a pretense for this. I'll just add that the police guidelines around the new public health response say that if somebody is affected by alcohol in public and they're breaking these minor sort of public behaviour laws, police shouldn't charge them for those sorts of things. They should, talk with them, offer support or leave them alone. We don't know, because these reforms are still quite new, we're not entirely sure how this is playing out in practice yet, but we just wanted to mention that police shouldn't be using those kind of minor offences to charge people or arrest people up who are intoxicated.
Yeah. And you touched on the guidelines there. What do the police guidelines say about how they should intervene when someone is intoxicated in public?
Yeah, so as I said, the guidelines say that if someone's breaking a minor law, there's some sort of like public order offence that's really minor, like offensive language, that sort of thing, police should try to talk to the person, offer them support, or simply leave them alone, as I was saying before. So the guidelines say it's not the intent of decriminalisation for members, that's police members, to rely on alternative low-level offences as a substitute for the repealed public drunkenness offences. So what that means is police should really be prioritising de-escalation strategies and avoiding the need for any enforcement action, charging people, fining people, arresting people, locking people up. The other thing that the guidelines say, which is important to note, is that if somebody calls 000 about someone who's intoxicated in public, the police should really only attend if there's a risk to community safety. Otherwise, they should, when they get that call from 000 or from ESTA, they should really say, that's not the sort of thing, that's not the sort of incident we'll be attending.
And I know that we also were speaking about this briefly before, that there are restricted circumstances where police can provide transport. Under what circumstances is that covered where police could offer to transport somebody who's intoxicated in public?
Yeah, that's right, Emily. So in very limited circumstances, police can offer to transport someone to their home or the home of a friend or a family member or somewhere else that's safe to sober up. Again, it's going back to that informed consent model. So they've got to get that person's agreement and make it very clear that they aren't under arrest. That person who is being transported can also change their mind. And if they do that, police have to stop and let them out as soon as it's safe to do so. Some other kind of strict guidelines around this, police have to get their patrol supervisor to approve it as well. And it's kind of a last resort if like a local outreach or a sobering centre isn't available, doesn't have capacity. Again, just emphasising that it's an informed consent model. It's up to the person who police are interacting with what they want.
And can you tell us a little bit about how We're Away practice can help individuals who may be wrongfully arrested, fined or detained by police with these public intoxication laws changing?
Yeah, absolutely. So, as I said before, we know that First Nations people are targeted and racially profiled by police. And even though we have this great new public health model, we're still concerned that there might be situations where police may act unlawfully or improperly exercise their powers. And we're still, because the reforms is fairly new, we're still getting a sense of how they're playing out on the street. So if somebody has an experience with police or has a client that has an experience with police that they're concerned about, we can advise that person about their legal options and represent them. As Grace said before, that could be with helping somebody get charges withdrawn. It could be help with a fine. And then in some situations where police have acted unlawfully, we could assist somebody to pursue a complaint or even bring civil litigation for compensation. So suing the police where they've acted unlawfully. We can also do things like advise people on their rights and help people obtain documentation and footage, like body-worn footage and CCTV.
Yeah, the work that We're Away does is incredible. So I highly encourage people to make contact if there is any circumstance that arises like this. Now, lastly, what message do you have for mob who might have interaction with police while intoxicated in public?
Thanks, Emily. Yeah, just going back again to informed consent, it's up to you what you want from police, and you can change your mind at any time. So whether that be help just to contact a friend or a family member, or be taken home, or be put in contact with a worker or a sobering up centre, a safe place, it's a consent-based model. If you feel threatened or hassled by police, you can ask them to leave you alone. There's only very limited circumstances, as I said before, where somebody needs serious emergency medical attention that police can call an ambulance. Other than that, somebody who's being approached while they're intoxicated by police isn't under an obligation to accept their help. You can contact VALS for support and advice, and we can assist you with that. And it's good in interactions with police to try to get as much information as possible. So name, station. If police ask you something and you're not sure whether you have to comply with it, you can ask them that. And it's totally legal, and we encourage people to film their interactions with police if that's practical to do so, or ask somebody who's with you to film it. You're allowed to do that.
Thanks so much, Elle. I think that's provided really good insight about what people's rights are now under these new laws and what police can and can't do. So thank you so much for that. Moving on to Melissa now. So Melissa, are you able to tell us VAHS is playing a critical role in the rollout of health services that are now in place following the decriminalisation of public intoxication? Talk us through the role VAHS plays and the importance of having a centralised service run by an Aboriginal community-controlled health organisation like VAHS.
No worries. So VAHS are just one component of the public intoxication response, with the other components being equally as critical. And we've all worked together on this for many months prior to the implementation and continue to do so now to ensure that people are supported across the state. So VAHS act as the intake, referral and dispatch, or the IRD line. We coordinate the inbound requests for support by conducting an over-the-phone intake with the caller. Our service is 24 hours a day, 7 days a week, and services all of Victoria, covering both Aboriginal and or Torres Strait Islander and mainstream services. So when we developed our model, we were mindful that all of Victoria was decriminalised for public drunkenness. However, there were certain areas of the state where there wouldn't be services set up, and how did we work with that? So in our model, we thought it was really important to be able to support those areas where there were either no services or limited services. So we ensured that at all times there was a drug and alcohol clinician accessible on the line to support with over-the-phone advice. And we also have a built-in service directory which gives information to other services with those areas that may be able to support on the occasion we may be restricted. Another component of our service which we felt was important in our delivery of this program was to have localised call operators on our line. We wanted to have people working on our line who had knowledge of communities all across Victoria. So our call operators are located in almost all the targeted areas of the reform. I guess for VAHS, it was really important that we were a part of this, given it had been over 30 years since the recommendations had come through the Royal Commission, and more recently, the strong advocacy of the Day family. So we knew how important it was to have culture implemented into this centralised service model, and that it was Aboriginal-led and Aboriginal community controlled. And not only were we confident we were able to deliver this due to having serviced the community for over 50 years, we were also very humbled.
Great. Thank you, Melissa. And I think it's great that it's a localised knowledge as well. That's really important. Can you run us through how the intake process works, and particularly phone referrals? What are the benefits for individuals seeking that support?
So currently this line is restricted and only accessible to first responders, 000, publicans and public transport operators. However, we have been advised the reform will move to phase 2 in coming months, giving access to other services and agencies. So our intake is quite comprehensive, ensuring that we assess the medical and safety risk of the person first and foremost. This can be challenging to do over the phone, so we do heavily rely on the caller's senses to assist us with what they're seeing and hearing. We ask a series of questions such as the person's first name, if known, their approximate age, the exact location of the person and a brief description. And then we ask them about their presentation, such as their behaviours. And we also ask if they know if the person has disclosed that they've taken any other substances. If the person has taken other substances, we will still call the outreach teams and inform them, and it'll be up to them to determine whether they'll be suitable for the service or not, depending on what they've used and the levels of use. We also look for things to identify whether the person has a medical condition, such as, we may ask, do they have a MediAlert bracelet on, or do they have any injuries, or are they breathing okay? From here, we then gain consent from the person for support, and we communicate all of that information obtained to the outreach teams, who then make the decision as to whether the person is suitable for their service. If they are, we obtain an ETA and inform the caller. So on occasions where a person may not be suitable due to reasons such as high substance use or a medical or a safety risk, we'll inform the caller to follow their due process. If the caller is not a member of the police or ambulance, we'll facilitate a call to 000 for them. I think the benefits of this is it may open up a door into services for people who may not have accessed them before, or not known how to, where they go on and potentially have continued support.
Can you also map out the involvement of other ACCOs and in the support system and what those services are that are available, particularly in the regions? And I think this also leads into a question that we have in the chat by Terry Brennan, who wanted to know specifically about Mildura. If you do have that information, no pressure. If not, we can take that question on notice and get back to it.
That's fine. So just in regards to the question in the chat, I will leave Ngwala to speak to that one when they present. And I'll also leave Ngwala to speak about the regional areas that they cover. as they are doing some incredible work in these spaces, as well as in the metro areas. So aside from that, we have Badak covering Ballarat, we have Badak covering Bendigo, Watherong over Geelong, and Rumballara covering Shepparton. And the hours of service do depend on the location, and they do all vary. There are some areas who do have sober up centres or places of safety running, such as Geelong, who have recently gone into partnership with Bowen Health, whereas there are others that are currently providing transport for individuals, but they are well on their way to standing up their sober up centres.
And can you discuss the role of other mainstream services like CoHealth Sobering Centre and how that fits into the broader support options available to the community?
Yeah, look, we work closely with CoHealth as they are the service provider to the mainstream community, the PIR. They're responsible for overseeing metropolitan Melbourne, and they also run assertive outreach teams throughout the city. There's also been occasions where they've come across an Aboriginal and or Torres Strait Islander person and contacted our line, and we've on many occasions facilitated a referral across to Ngwala from CoHealth to ensure that the person's supported in a culturally safe and appropriate manner.
Great. And lastly, what do you think is the most important information for community members to know about the new supports that are in place?
It's a good question because, for me, I think it's really important to note that by calling through to the PIR, the person you're calling about will be supported in a culturally safe and supportive environment. Whether they're taken to a place of safety known to them, or we can support them in contacting a family member to come and collect them, or even if they do end up going to the Sober Up Centre, they will be supported and will be looked after with the option of follow-up support if they choose to have that. Like, as a mum of 3 very social boys who don't mind a party now and then and a drink, I would much rather them get supported to get home safely than be left in an unsafe situation for having a few drinks and a good time. I feel that the work's being done here is so important, and we've had some amazing good news stories where people have engaged the teams and been referred into their local ACHOs for continued support. I mean, like, looking at our March data, we've had just shy of 1,000 calls on the line, with just under 400 of those being dispatches, and around 25% of those dispatches have been Aboriginal and or Torres Strait Islander people being supported through sober up centres or transported home safely. And I know the assertive outreach teams, the numbers there are much higher, and they're supporting so many more people.
That's incredible outreach numbers.
Yeah. So, I mean, these numbers tell us that, just under 400 Aboriginal people weren't left with criminal charges or court appearances. And more important, they were not left in unsafe situations. So I guess the message is, don't be afraid to call the line or be unsure if you should call. Ask the question, can you help? A lot of our call operators that are on the line are Aboriginal people from all over Victoria, and are there to talk through with you how you get that person's support. Because at the end of the day, we all want our family and loved ones home safely, and this program aims to do that without the intervention of authority or justice involvement.
Absolutely. Thank you, Melissa, and thank you for all the work that you and VAHS are doing. It's great to see this health response now being implemented instead of criminalisation. So it's fantastic. Thank you. We're going to be moving on to BJ and Motu. Up to you who wants to answer the next question, or if you both want to have a stab at it. But first question for both of you. Ngwala provides the only Aboriginal sobering centre in Victoria based in St Kilda, servicing Metro Melbourne. Can you take everyone through what it's like at the sobering centre and what kind of supports are available during people's stay there?
Sure. So the team here, we will receive a call from VALS from dispatch about a community member. The team will gather as much information from VAHS, description, the situation that's happening. And once doing that, the team will then go out with the nurse, and the nurse will assess the community member, make sure that community member is safe to transport back to the centre or home or wherever the safe place that they wanted to go. If it's safe to bring back, they'll bring the community member back, where observations will be done frequently and that they're monitored on a regular basis. They have an option. They can, when they come in, they don't have to go straight off to sleep. They can have a feed, shower. They want to do some washing. We have like a lounge room. They can sit and watch TV, whatever is comfortable for them. If they want to have a sleep and go and have a rest, they do that. We let them do that. Once they wake up, we'll just check on them if they needed any further services. We also have our other office, Wellington Street, with AOD services, family violence support and homelessness, housing and homelessness. So if they're wanting to be linked into that, then we'll link them into that as well.
Amazing. It sounds very holistic and a lot of pathways that people have access to. The next question, Ngwala also provides outreach services alongside the sobering centres, as you touched on there, as well as in the regional outreach across Mildura, Traralgon, Swan Hill and Lakes Entrance. Can you talk us through those outreach supports to the community? And also, I think that directly goes to Terry's question in the chat about Mildura support, if you can touch on that too.
Yeah, thanks, Emily. Yeah, just to clarify, it is in St Kilda, the Sobering Up Centre, and what an amazing job that BJ and her team do to make it into a home, into a safe space for community to feel welcomed and accepted, but also feel comfortable that they know that there are other services or supports that they can do or can receive from the Sobering Up Centre. So just wanted to acknowledge BJ and the work that she does massively for Ngwala. We wouldn't be able to be in a space without her. But yeah, the outreach, I guess, for us, I think everybody knows what, when it was the trial sites that they started with, and when it got to a situation where they were unsure what those sites were, we were fortunate enough to have the site in Dandenong. So they didn't actually have a physical site for people to go to for a place of safety. So they asked us, what are we going to do? What's Ngwala's stance in this if there are no trial sites to take community? So we decided that we wanted to do an assertive outreach. So we went out and we got a coffee van, and we said that we'll go to the community rather than them try and find us. We'll go out to them and we'll mix it up with the other services that are out in Dandenong and see where all the hotspots are. And that kind of opened up the space for us to create an assertive outreach. So although BJ has a team, a public intoxication response at the Sobering Up Centre, if we're not getting any calls from Mal's team, VAHS, well, then that team will just go out there and do assertive outreach in the areas, in the local areas. And it's been a massive response because we're getting people that want to engage with us. They're seeing us regularly out there in the streets, wanting to have a talk to them. And I guess the beauty about the coffee van is that it's a tool. So it's a tool to engage community. Then they can sit and have a yarn while they're having a coffee, open up and be vulnerable to open up about their challenges, and in the hope that we can service them in a positive light. And that's the same. So obviously, the Sobering Up Centre in Mitchell Street is 24/7, 7 days a week. But in the regions, Mildura, Traralgon, Swan Hill and Lake Entrance, we're at the moment looking for a place of safety. So we're looking for places to turn into Sobering Up Centres there. And then once we have established those Sobering Up Centres, then we'll probably do a similar model that we have at Mitchell Street. But at the moment, we run a assertive outreach service in those areas from Friday to Monday. And it's normally active hours are 3 p.m. to 11 p.m. And we're on call from Friday afternoon to Monday morning. And all we do is go out to, like, if we get a call from VAHS to go out somewhere in, for example, Swan Hill, Mildura, we'll go and assess the situation in the hope that there is a place of safety to help them locate them, find a place of safety for them. We also understand that, there are a lot of community members that are sleeping rough. So we do have, some equipment like rough sleeper packs where we hold, a 2-tent, sleeping bags, some clothes that we've got in those rough sleeper packs that we're able to give out to community members that are sleeping rough. But I guess the positive thing around that is that we're engaging with them and we're hoping that we can link them up to, housing services that can find better, longer suitable accommodation for them.
And that proactive response just sounds so important because those people may not have originally made the first call, but you're out there on the ground and making that.
That's right. We've seen such massive success in the one coffee van that we went out and bought two. And now the idea is to service, the whole southeast and the whole northwest regions of Victoria. So hopefully we can get that out, the second van out there as soon as possible.
That's incredible. What do you think Ngwala's main point of difference is as opposed to the mainstream health-based response run by CoHealth? And I know you've said it a lot already, and the coffee vans even, and going out there and being in community is a prime example. But is there anything else you want to touch on that differs from CoHealth and other mainstream services, I should say?
Yeah, I think BJ will probably be able to answer this, but I guess for us, I think you stated it in your opening statement, Emily, around, culture and having a culturally approached safe space. And so we provide that for Ngwala, especially at the Sobering Up Centre. I mean, I'm not too sure, but there are many people that are on this webinar that have been at Mitchell Street and seeing that when they walk in home, a clinical response. And that's nothing to take away from the other services that provide that type of approach. But for us, it's a home. Like you walk in there, there's a guitar there. There's like beautiful artwork that are on the walls. And I guess it just helps community members feel welcomed. We pose no judgment in the way they come to the Sobering Up Centre. So I think, BJ, you want to talk more about that culture and talk about how you've brought that upon to turn the Sobering Up Centre into a home.
So how I would put it, imagine a hospital and a home. Hospital, you're a patient. Home, your family. Here at the Sobering Up Centre, we're very compassionate, we're caring, we're empathetic. Environment created by the staff here who are skilled and understand the medical difference between Aboriginal community members and mainstream community members, which makes our home more than special. I think it's unique, Yeah.
Yeah, a touch of home there.
Yeah.
Can you share with us some of the positive outcomes that you've seen from community members accessing both the sober centres and those that you've been able to support in outreach?
Yeah, sure, Emily. I think some of the positive stuff that we've seen come through the Sobering Up Centre is, we've had a couple of occasions where community members have returned to country. And so they wouldn't have initially done so had they not connected with the Sobering Up service through the community members being vulnerable and open enough to talk to us about their challenges. We were then fortunate enough to find or connect them with services that allowed them to return to country and find healing in their own space. I think that's been massive for us. I think for us, it's about community members not falling through the service gaps. And so because they're connecting with the Sobering Up Centre, they're able to connect with other services, for example, the homelessness, finding ways or finding, launch housing or somebody that's out there that's able to connect them into finding accommodation or suitable accommodation to help their homelessness. But, not only that, there's also drug and alcohol comes domestic violence. And so being able to connect them with services. And it's just been amazing to see that the community members that we're seeing come through the Sobering Up Centre are utilising, the other services, and seeing them not fall through the service gaps has been amazing for us. I think that's just been massive for all of us here at Ngwala.
And I think that just also shows how important ACOs are as well, that there's a culturally safe response, that people feel empowered enough to reconnect with their culture and go back on country and everything, where they may not have received that from a mainstream service. So that's really important. Is there anything else, BJ or Modu, you'd like the community to know about the supports and services that you provide? I know you've said a lot to us already, but is there any other things that you think might be important to raise?
I guess for me, hearing VAHS and the amazing work they do and obviously connecting with them to obviously service community members, is the fact that we just care. And so we hope that community have an understanding that we take the advocacy of the Day family serious, and that we want to push for this, for better outcomes for community members. And I hope that they find positive change, through the challenges that they're facing. And so, for me, it's about that, letting them know that we're there, we hear their voices and that we care, and that we take this work serious, because we know how hard it's been, to get to this point. BJ, you got something?
Summed it up.
Yeah, I think you summed it all up there. Good job.
All right.
Thank you both, and also for the impact that you're making through Ngwala. That's the conclusion of our formal questions for the panelists. We now have a little bit of leftover time. If there are questions, please enter them in the Q&A box and we'll try and get to most of them. We do have one here from Terry, and I believe it's addressed directly to Melissa. He or she, I should say, missed the number. Are you able to provide it in the chat if it hasn't been ready?
Yeah, so as I spoke of earlier, the number's currently restricted and only accessible to 000 public transport operators, publicans, and police and ambulance. But they will be going to phase 2 in coming months, which we believe the number will be given to, potentially ACCHO's, emergency department. We've had occasions where the number is out there, and we've had calls from people in the public or, wherever it might be. We still do the intake, we still take the call, we still conduct the intake, and we still make the referral to the outreach team. So our advice to anyone that doesn't have the number at the moment is to go through 000, and they have a process in place to contact us.
Thank you. The next question we have, this you've just answered, Melissa, but in terms of Ngwala, is there a direct number available to the public for people to call the two of you?
Thanks for the question, Emily. No, at this stage, we go through VAHS. So all our calls are normally directed through VAHS. I will say this, though, as we spoke earlier, we do a sort of outreach out into the streets. And if we find that somebody is in need of our services, or, for example, need to come back to the centre, or for us to pick them up and take them home or somewhere to a place of safety, we will contact VAHS to inform them that we've connected with a community member whilst on a sort of outreach, and that we plan on servicing them.
Okay, great. Thank you. Melissa, I'm not sure if this is something that you'd be able to comment on, but will there, with the rejection of the second safe injecting room by the state government, will that impact the work that VAHS is doing? And if so, how?
I think that's a bit too early to tell. You know, I think we've just reached out to the injecting room in Richmond, actually, because we do receive calls from them, and this is about public drunkenness, and it's not about intoxication of all substances. We're fully aware that there's going to be people that have consumed, alcohol and maybe taken something else, and like I said, we still do the intake, we still make the referral, and it's dependent. It's an individual needs assessment, I guess. It's dependent on what they've taken, how much, all that sort of stuff. So as far as the rejection of the second injecting room, it's a bit too hard to tell yet whether that's going to affect us. We've only just started receiving calls from the injecting room, so we're not sure where that's going to go.
Thank you. The next question might be appropriate for Elle. In terms of, I know that it says that we don't have data yet what is happening with police response, but they're interested to know whether racial profiling may continue to prevail, or is education of Victoria Police members on cultural safety actually happening?
Yeah, that's a great question. It's a great question. I don't know the answer to it. I know that there is an official commissioner's instruction about the changes to public intoxication laws, and all police officers should be aware of that. In terms of what training is actually happening on the ground, what cultural awareness and cultural safety training police are getting, I don't know. I think that's a really important question for us to follow up with VicPol and try to get an answer to that. And I'm happy to kind of take that on notice, follow that up, and keep people posted about what we find out.
Great, thanks, Elle. The next question might be most appropriate for Motu. It's from Angelica. Will there be a person outreach team on the ground for the Mildura, Robinvale, Swan Hill area also? That on the ground outreach work is great. And I think you sort of touched on this before when you were discussing it, Motu, but did you want to clarify?
Yeah, sure. Thank you for the question. Yes, at the moment we're looking for sobering up centre properties or safe space property out in the regions. We found a few that we quite like out of Mildura that we are going to use for a place of safety. And at the moment, we are servicing, like I said, from Friday to Monday, and the outreach are actually staying at a hotel at the moment. So what the hope is to service community and find local mob that live out there, that know the mob out there, to work for the sobering up centre once we get a place of safety. And then once that happens, then we'll be able to service a more broadened area like Robinvale. We plan on finding a place of safety in Swan Hill and in Mildura. So that's the hope in the future.
Great, thank you.
I see Auntie Dawes is on, and she asked the question about police updated on the program. Is that okay if I just answer that, Emily?
Yeah, absolutely. Go for it.
Hey, Auntie Dawes. Yeah, so we've worked tirelessly with police to try and inform police of our services. We connect with them regularly, weekly, around our services and what areas we are servicing. However, you are right. We do come across members when we're out in the streets that have no idea that there is a PIR response. And so although they actually have a public intoxication reform team within Victoria Police, we are still finding that members are unaware of that there is a service. I'll give you an example. I was in Traralgon last weekend, and a member was out in the public when seeing us engage with community members, and he asked us what we were doing there. I explained, and he said, I thought the number was only for the city. I had no idea that the numbers for everywhere. So although we'd hoped that, our engagement, Mel's been going around with the Victoria Police, engaging with them. I have with the inspectors and superintendents and staff on the ground, members on the ground. But unfortunately, there are members out there that have no clue that there are services out there that are supporting public drunkenness. I hope that answers it, Auntie Dawes, but happy to take a call from you.
Thank you. Our next question, Melissa, it might be best for you to answer. Is the process through 000 for members of the public working? This is from Rachel Eddy of The Age.
Yeah, so it's sort of only really just recently began happening that we'll get calls from people outside of those services that have the number. So far it's working. That we for example, a couple of months ago, we had a phone call from a librarian who they said that they had people that would gather on the street outside the library, and what was the process? And we just said, unfortunately, we couldn't share the number. If they go through 000, they'll get the support. So they do that. So we haven't really had any, it's hard to tell yet. I think it's still really early stages, but, predominantly the callers are from those agencies that have the number.
Yeah, good to hear that it's working. Is there any other questions? So looks like we've answered everything that's come through so far. If there's any other questions, please pop them in the Q&A section. Might give you one more minute to get anything through. While we're waiting, I just want to say a big thank you to all the panelists today. They've given us some great information about the new changes and supports that are available and that will continue to roll on out. And there's plenty of us to reflect on today. And thank you to everyone also that's joined us in the audience. We've just had one more question come through. So when members of the public call 000, is it possible for them to avoid speaking with police?
That's a good question. So we are actually, because we meet with the police and ambulance and 000 from time to time, and we've actually invited 000 to our next outreach provider meeting because we would like to get clarity on that. From my understanding, 000 is, I'm unsure how it works. It's like a bit like a triage service, and depending where the call source is that comes to them. So I don't believe that it's always police. It could be someone else. That's something that I would have to clarify, but I can actually get that information and send it across.
Thank you. I think that's pretty much it. So Ruth has just mentioned that an update on cultural safety education, once you've been able to follow up, would be great. Again, thank you everybody for being here today and our panelists. And if you would like to support the work that VALS is doing at the moment, there is a donation section on the VALS website. And just a reminder that if today's discussions raised any issues or concerns for you, we really encourage Aboriginal and Torres Strait Islander people to call Yarning Safe and Strong, which will be put again in the chat function with the number. And then also anyone can call Lifeline, and that number will also be in the chat box. I hope the stories and insights shared today stay with you well beyond this webinar. I encourage everyone to continue to reflect on how we can make a difference in shaping an effective health response to public intoxication. And thank you everyone for joining us, and to our amazing panelists and the organisations that you work for.